Hi, Jess. Can you hear me?
I can, but I
Okay.
still can't see you.
Oh.
Wait a minute. Okay, there we go.
Oh, I love it. All right, so
You
we
know what? I've
are.
never done this
Oh,
before.
there's a new time for everything.
I know.
All right, so we are actually speaking with Jess Beagle today of West Boylston, Mass. She owns Deep Relief Massage Therapy. And how long have you been a therapist, Jess?
Since 2001.
So 12 years? Yeah,
Yeah.
12 years. Wow. Did it go by
Well, close,
fast?
actually closer to 13 because we're
Wait,
in, yeah,
cool.
yeah.
So I wanted to talk to you today about cranial sacral massage therapy because I know nothing about it. I don't practice the modality, and I actually have quite a few clients that have asked me about it. So I thought in today's Anatomy Tuesday I would cover that. So kind of just give me a overall intro of what it is and why it's effective.
Well, cranial sacral therapy is a very gentle, light modality. I always tell people that, right off the bat, we work on making very micro adjustments into the flow of the cerebral spinal fluid, which circulates around the spinal column in the brain. And we also make very micro adjustments to the bones in the skull as well. And it's very, very light work where most people at first might not even notice anything is happening.
Okay, so it's not like a deep tissue massage.
Oh, no, no, no. Yeah, quite the opposite,
Okay.
actually. People are face up on the table the whole time.
Mm-hmm.
You also are completely closed as well.
Okay.
I tend to put a blanket over people because you tend to get chilly after a while. But other than that, you just come in comfortable clothes.
Right. Oh, that's cool. And how long is a session usually? Can you do like a 30-minute session?
Um, no,
Okay.
it might take, especially if someone has never had the work done before, it
Mm-hmm.
might take a half hour just to get into the flow of what's going on. So usually it's a minimum of an hour, and if somebody has, like a lot of stuff going on,
Yep.
then they might need to do a 90-minute session.
Okay. And like if who comes to you? Like what kind of things are they struggling with?
Well, cranial sacral therapy takes care of, a lot of different concerns with people. For example, I have a client of mine that's been seeing me for quite some time. She actually had an epidural when she had her baby, and
Mm-hmm.
everything that could have possibly gone wrong with the procedure did.
Oh no.
So, spinal headaches that never went away, pressure in the spinal fluid, loss of pressure in the spinal fluid. She had, bleeding in her spinal fluid, had to have a blood patch, and that one didn't work, so she had to have another one. So, it's been a long, tough road for her.
Mm-hmm.
She had constant headaches for, I want to say, at least a year to a year and a half before, we've got it under control.
Wow.
But most people actually go to cranial sacral therapy because of headache type issues, actually.
Okay.
That's what brings a lot of people to it. That and TMJ.
Oh, all right.
Or if anybody's had any type of head trauma,
Mm-hmm.
been in a car accident, kids playing sports and they get hit in the head, concussions,
Mm.
football players, getting hit in the face with a baseball or a softball.
Mm.
Um, Anybody that's had extensive dental work tends to do well with it. Braces tend to do a lot of shifting of the bones in your face.
Yep.
Especially if it's, if you need a lot of dental work for, fixing your teeth and stuff, that really does a number on people's sinuses as well, and that can contribute to headaches down the road.
So I'm guessing that one treatment really isn't going to solve the year-long headache syndrome.
No.
Okay. Okay. So,
especially if someone's never had the work done before.
Mm-hmm.
I always tell people, if this is their first time coming in, you need to give it a chance.
Mm-hmm.
A minimum of 2, 3 is usually better.
Mm-hmm.
Because it's such light work, people need to be in a more meditative state and be very open to receiving the work.
Okay.
Usually the first time people have it done, they don't quite know what to expect.
Yep.
But once they've had a couple times, now they know what to expect, and they're much more relaxed and open to the work. Because, even though it's non-invasive, people still get a little nervous because they don't know what's going to happen.
Yeah. Well, I would assume you're messing with, you're not messing with, you're putting back and realigning the spinal fluid. That's something totally that you would never even, we never see it. We should never see it.
Right.
It's something that's very unknown to us. And, when you get into I think a lot of clients, when they get into things that it's not common.
Right.
The anxiety starts to just rise so fast.
And a lot of times, with pain, like with headaches and stuff, there's an emotional piece to it, as well, because being in pain like that all the time really wears on people.
Yep. Same thing with chronic pain. Yeah, chronic pain.
Right.
You have it all the time, every day. It causes depression, anxiety.
Yep.
I see it all the time with my chronic pain clients, and especially headaches. That type of pain, I think jaw pain and headache pain is so severe because now you're affecting, the way that you can think, the way that you can see, the way that you can hear, and all those senses when they're hurting. That's just, I think that's probably the worst type of pain out there.
Right. Yep. I agree. And, especially with jaw pain, headache pain, it's like it's your head. There's no place for it to go.
Yeah. Yeah.
It's not like if your finger gets swollen, it can just creep up the finger a little bit more.
Yeah.
With your head, it can't go anywhere.
Yep. For sure. So what do you have maybe a case study that you could talk to us about of someone other than, you just mentioned that I would never even thought of getting an epidural could have done all this, but that makes sense because that's going into the spinal region. So how about maybe someone that suffers from TMJ or headaches that you've been working with, and how many treatments have they come to see you with? What are they coming back with and saying, hey, this is, this type of pain has decreased and things like that?
So most of the clients that I do see have different types of headaches, because there's migraine, there's tension, there's sinus, allergy type stuff. So what I tend to do with those clients, and what I found to be really effective in taking care of a lot of different things that are going on, is I work on opening up the sinuses, because I find that a lot of people who have chronic headaches actually have impacted sinuses, especially around the cheekbones and the nose.
Yes.
Their sinuses are impacted. And also I work on opening up the ear canal, because all that fluid needs a place to go.
Right.
It's going to accumulate pressure all in your face and in your head. So that's usually the first route that I go, is working on opening up the sinuses and get them non-impacted. And that might take 2 to 3 treatments depending on what's going on. And when I do that, I notice people will call me like either on their way home or send me an email the next day or something going, I had all this fluid draining out of my ears and down my neck, and I slept fantastic.
Wow.
And like my headache was gone.
Oh, that would creep me out, man. If that happened to me. But you know what? If I was suffering from that, I probably would be like singing hallelujah in my car.
Because a lot of times with headaches, it's actually the pressure of fluid in your sinuses.
Yeah, for sure. Oh,
and
wow.
So that's usually the first place that I start with chronic headache people. And then we, go from there.
Oh, cool. Well, that's cool. And what about, I know there's something about the sacral region, obviously. Do you ever do it face down?
No.
Okay.
Only because that's not the way that I was taught. I've heard some people that do cranial sacral therapy face down. I just don't do it that way. When I do work on the sacrum, also known as the tailbone, it's, face up. I put my hands, right underneath the sheet and I cradle it.
Oh, okay. Yep, that makes sense.
Just to help, make sure that we're getting all that flow of fluid completely down the spinal column and making sure it goes all the way completely up.
Okay.
And a lot of issues can be corrected by making sure that the tailbone is moving in all kinds of directions. Sometimes, a lot of times with people, if they've they've fallen on their tailbone or if they've cracked it, injured it, that kind of stuff, it gets pulled out of whack.
Yeah.
And I work on making it more balanced by different cranial sacral handholds that I know to help loosen everything around so they can sit correctly, in the low back.
And I think a lot of people don't realize that when you do injure yourself, there is the trauma that happens just because the inflammation goes away doesn't mean that you're healed. You're
right.
left with the residual of the impact. That could be in scar tissue, that could be a buildup of fluid, that could be some sort of blockage that happens. And I think a lot of times clients don't realize that you need to do the work to kind of work that out, and then you'll start to see such great, amazing results of just being pain-free.
Well, and I think a lot of people don't know with a traumatic injury, it takes 18 minutes for your soft tissue to change its shape and go and fix itself to the way that it was injured. That's an incredibly short amount of time for your body's blueprint, so to speak, change the way that it was made. And that affects everything else. Especially, example, like falling on your tailbone, that goes, anybody that's fallen down a flight of stairs is going to tell you it goes right up your spine.
Yeah, for sure. Wow. I didn't know that about the 18 minutes.
Yeah, it takes exactly 18 minutes for your fascia to change with any kind of traumatic injury.
Oh, wow. I don't know. Did you learn that from Rondell's class?
Yes.
Oh, wow. I took that. Was it the first class or the second?
You know what? I don't.
Say the second so I'm right. No, just kidding. I took his first class and I don't remember that.
Yeah, I've taken all of his courses, so I want to, it was in one of his classes we talked about how fascia changes, how quickly it changes in injuries and stuff.
Yeah, I love learning about stuff like that. I'm such a freaking anatomy geek, it's ridiculous. It's so ridiculous. All right, cool. Well, this was great. I loved chatting with you.
Me too.
And we'll have to do another call. Me and my pain management, I love talking about that too. So maybe we'll do one on chronic pain.
Yeah.
That'll be fun. All right, cool. All right, so then I'll talk to you later. Thanks for being on the call.
Thanks for having me.
All right, bye.
Bye.